Hey everyone, my name is Emma and today we're going to be talking with Anna Noel from the Counseling Center at Rose-Hulman. I'm going to be asking her a few questions about mental health and how we can maintain good mental health. So, enjoy the video!
My name is Anna Noel. I'm the Assistant Director of Counseling and the Coordinator of Clinical Services. So I do a lot with our internship program, and I also do a lot with kind of coordinating clinical care. So I manage the waiting list and kind of do things that relate to the clinical pieces.
What sort of services are offered at Rose-Hulman's Counseling Center?
Yeah, so we will offer individual, group, and couples counseling sessions. And then we also offer crisis intervention. So if someone is experiencing thoughts of harming self or others, we can intervene in those situations to kind of help them develop a safety plan and get them the help that they need to avoid acting on those thoughts. We also provide consultation. So basically that's giving people an opportunity to kind of talk through a situation, or if they may need a referral, and that could be for faculty, staff, or a student. And then we also offer outreach. So with our outreach we have several different awareness months, and it's basically focused on bringing awareness to that particular topic.
What do you think are some of the best ways to work through test anxiety?
Yeah, so a lot of times we'll work on relaxation skills or grounding skills with students that are experiencing testing anxiety. We actually have a resource packet that we developed because we have a lot of students come into the counseling center and they're experiencing test anxiety. So what we also suggest is preparing well for the test, sort of working on your time management, engaging in self-care, and trying to address maybe negative ways of thinking that might be interfering with your performance on the test, but also the preparation for the test as well, and sort of how you're looking at the situation.
Can people go to the counseling center to figure out if they need testing accommodations, or do you have to refer them to someone else to get that actually official?
Yeah, so what we do with the testing accommodations is that we'll have them come in for an intake assessment, and we'll try to fully assess, what might be triggering the issue with testing. And then once we've done that, we work with Patty Eaton in accessibility to complete the accommodations paperwork if we feel that accommodations are necessary. But doing an assessment helps us determine maybe what is the reason that they might need testing accommodations, because there can be different reasons for that.
What are some good ways to manage stress associated with school, and do you have any tips for balancing school with extracurricular activities and also family responsibilities?
Yeah, so it's really important with managing stress to make time for self-care, so examining those different parts of your life, the emotional self-care, physical, making sure that you're meeting sort of your basic physical needs, so eating, sleeping, and those sorts of things, and having a social life as well. Like that can help you relieve stress, and it kind of fits into what you were talking about with making time for family and social relationships. So kind of reframing how you're thinking about that and recognizing that it's important to do those things, and sometimes that means looking at how to manage time as well, and how can I fit all of these different things into my schedule so that I'm engaging in self-care, and that will help manage stress. Also, we in the counseling center a lot of times will focus on relaxation and making sure that you're making time to just kind of take a break from schoolwork.
Mm-hmm. What if you're the type of person who has a very hard time saying no to people because you don't want to hurt their feelings or something? Do you have any advice for them? Like, what if they actually cannot accept any more responsibilities? Do you know how you could help them through that?
Yeah, I think that just helping, that what we would do in the counseling center, if maybe that was an issue that they came in with, is just help them identify sort of what they need and how they might be able to balance that, but also how they can, set boundaries and say, in a nice and polite way that I need time to do this, other thing, and set that boundary with that person. And being open and honest, a lot of times people will be more understanding than you might think, and it's kind of that negative way of thinking that they're going to react in a negative way, when a lot of times I think students understand, like, you have it's difficult to balance all of the responsibilities here.
What advice might you give to someone who wants or maybe needs to reach out for professional help and they are nervous about doing so?
Sure, yeah, that's common that people will be nervous to come in, and I would say to encourage them to just, come in for a consultation, even if you just have some questions about the process and what that looks like. You can also call. Chrissy, our administrative assistant, can kind of answer general questions, or if you'd like to talk to a clinician over the phone, kind of just have questions about the process and what it looks like. Also, we've had students come in with a friend, just like for that first time, like they'll accompany them to the counseling center, and that kind of eases their mind and help them with making the appointment and that kind of thing, or help them by going with them to the appointment. That can be really helpful.
Cool. Could you explain a bit more what a consultation is and what exactly it entails? Is it just questions, or?
Yeah, it kind of depends. So, for example, the staff may have questions about how to manage a situation with a student, so they may come in and ask different questions, but then students may have, maybe they don't want counseling services necessarily, but they have questions about how to manage a certain situation. So like maybe they have a conflict with a roommate, for example, and they want some to kind of talk through how to manage it. Or they may have a friend that they're concerned about, and they're not sure, what to say or what to do to encourage that person to come in. So they may come in for a consultation to sort of talk that through, what they can do. So they're not necessarily wanting services for themselves, but sort of wanting to figure out how to manage a different situation. But also consultation can be used for like referrals. So if we have staff or a student that they know they want some services off campus, we can kind of help with that process of looking at getting them services off campus. We have a list of all the different services that are offered in the community.
Cool. So some of that actually leads really well into my next question. What do you think is the best way to be supportive of someone with anxiety or someone with depression?
Yeah, I think a lot of times it's just being a listening ear and letting them know that you care, and offering to help them get help. Like I said before, walking with them to the counseling center, helping them come up with a way, a plan to get help. When they can go to the counseling center, or other ways that they may need to get help through other offices or other channels.
Yeah, I've also found that like with my engineering brain, I sort of automatically go to like problem solving and solutions, and that might not necessarily be what they want. So usually if people come to me, I stop and I ask them, I'm like, are you looking for comfort or are you looking for solutions? And then that helps them not be upset immediately if I start just going into solving their problems for them. So
yeah, I think that's great that you do that, because listening is key, but then kind of clarifying, what do you need? How can I be helpful? I want to help, but I'm not sure how. So I think that's a good strategy for sure.
What are some ways to maintain good mental health without necessarily taking medicine?
For some people and for some mental health conditions, medications can be really helpful, and it can be really good to use in conjunction with therapy or other ways of maintaining your mental health. But there are ways to do that without medication. So I think engaging in self-care is really important. Developing your social system or social support system is a really good way to maintain that as well. And then therapy, of course. is a way, it kind of creates that space to sort of process emotions and learn coping skills that might be interfering with that ability to kind of maintain your mental health.
Awesome. Could you talk a little bit more about therapy? Like, what are some benefits that people might receive from therapy?
Yeah. So benefits, so there's different types of therapy, which kind of talked about like the different services that were offered. So with individual therapy, a lot of times it's beneficial because it helps you kind of have a space to process emotions and, you know, confidential, non-judgmental environment, and learn some coping strategies as well. With the group sessions, a lot of times what's beneficial of that, and you can learn those things in group counseling as well, like the same as in an individual, but what's different about that a lot of times is you can learn to communicate with others and get feedback and share feedback, and it kind of creates a social environment that allows you to like overcome anxiety. A lot of times that's an issue that can be helpful to be addressed in social or in group sessions. And then with couples, again, communication is something to focus on, and kind of learning to be open and express feelings.
Could you explain the concept of emotional intelligence and why it is an important skill to hone?
Yeah, so emotional intelligence is basically being able to kind of understand your own emotions, but also the emotions of others. It can help you learn how to empathize with others, kind of be able to connect to your own emotions, and it's really important, especially for relationships, because it helps you understand how your emotions impact others, but also how to understand other people's emotions.
How might someone reframe a situation so that they can find a more balanced perspective? So like if they're looking at someone or something from just one side or one point of view, they might get down about it. Do you have any tips for how they might look at it in a different way?
Yeah, so a lot of times that's a skill that can be worked on in therapy, is learning kind of how to examine what other alternatives there might be. So kind of taking a step back and reflecting on the situation, sort of identifying, what are some other different perspectives or different ways to look at this situation, and sort of examining the evidence too. Do I have evidence that supports how I'm looking at the situation? Do I have evidence that kind of discounts it? And that can kind of help you come to a more balanced view.
Do you have any advice for someone who is frequently worrying? And what about someone who frequently makes dangerous what-if statements that can be very harmful to their mental health?
Yeah, so worrying can kind of go with a lot of different mental health concerns. So it might be anxiety, it might be stress, it could be, tied in with depression. So I think it's good to, maybe go to the counseling center or process that feeling to kind of identify where that's coming from. There's lots of different options to be able to kind of manage that worry. So that might mean medications for some people, or it might mean therapy, self-care, some of the things that we kind of already talked about, like practicing relaxation and those sorts of things. But I think the dangerous what-if statements, that could sort of signal that there might be some thoughts of self-harm. So if that's the case, I think it's best for that person to get immediate help, or others that may be aware of that to give them assistance in getting help and sort of address that, and work on how they can develop a safety plan and to avoid acting on those thoughts.
Why do you think mental health is such an overlooked topic, and what can we do to change that?
Yeah, I think a lot of that has to do with the stigma that's attached to mental health, and also just there's a lot of discomfort in talking about feelings and talking about mental health in general. So I think some ways to overcome that are just to be supportive of others that are struggling with mental health concerns, kind of continuing to increase awareness, speaking out about mental health concerns, and just continuing the conversations about it as well. The more that we talk about it, the less stigma I feel like is attached to it.
Well, thank you so much for talking to us today, Anna. We really appreciate it.